Hello and welcome to another episode of 12 Health. My name is Shannon Hegy, and today we are talking about tick season and the infectious diseases that can come with ticks. It's an especially difficult year for ticks here in New England, and joining me to talk about this today is Dr. Subtain Zia from Southcoast Health. Thank you for being with us. And our very own assistant news director, I should say, Ryan Clifton, who generously has agreed to talk to me and be a little candid because he himself was recently diagnosed with Lyme disease. So thank you both for being here with us. I know This is something we talk about every single summer, but this summer especially seems to be worse than years past. The CDC says ER room visits for tick bites in the Northeast are at the highest levels in 5 years. And that is because of the fact that the weather, I think this spring was especially rainy and the ticks just didn't die the way that they normally do, right?
Well, thank you for having me. Yes, I would agree with that. And also, if you look at the data from the state of Massachusetts, for example, since March, there's been an uptick in terms of people going to the ER for tick infections. So certainly at the highest, and summer usually is the peak season.
That's right. Okay, so I know we always hear all of the warnings and what to do and what not to do. But this year, I think it's important to note for everyone listening out there that you may think this isn't going to happen to me, but with these numbers higher, we really all need to be vigilant. And Ryan, for you, that was kind of the case. This came out of nowhere.
Yep. I was at a graduation party on a couple Saturdays ago. And by the time we were leaving on the way home, the symptoms started full force. I had been out doing yard work maybe like 5 days before that or 6 days before that. Noticed on my thigh, I had like a little mark, almost like it looked like poison ivy a little bit, sort of like a, not the circular thing that you hear about. It was more of like a rectangular, like splotch or something like that. Sort of like a little bumpy, raised, looked like poison ivy, didn't itch or anything like that.
Not the target that we always, or the bullseye that we always hear about.
And I noticed that probably midweek. Went to the graduation party on Saturday. On the way home, hit me like a ton of bricks, teeth chattering, chills, really, really high fever. Went home, went right to bed thinking it was just maybe I ate something off because, sometimes at parties there's food sitting out. But that wasn't the case. The next morning I woke up, very feverish still, achy, nausea, almost like a bad flu. So, that was a Sunday. I thought maybe I'll sleep it off, come to work the next day. And, by that time it was really rough, very little sleep, aching headache. The glands at the base of my skull were very swollen. It was just a really rough, few days. Finally got to the doctor on Tuesday and took one look at what had now become a circular bullseye on my thigh. I noticed that change midweek or early in the week. Looked at it and said, that's automatically a positive case of Lyme disease. It could have been something else, but the treatment, he said, was the same. So he prescribed me some antibiotics, which I am almost done taking. Told me that it could be a few days before I started feeling better because of something called a Herx effect. Does that sound familiar? Basically told me that a lot of the bacteria would be dying in my body, and your body just kind of like doesn't really know what to do with it all at one time. So you might exhibit symptoms of fever, the same kind of symptoms I had been feeling. I would say probably the worst of it was the not sleeping.
Just because of being so uncomfortable.
So uncomfortable, very hot, but teeth chattering, chills, just very uncomfortable. Maybe I slept an hour at a time over the course of like 3 days, Saturday, Sunday, and Monday, maybe like 3 hours a night. Trying to fall asleep in a chair, anything different. The only thing that brought me any relief was wrapping my head in ice.
Oh my gosh.
And just sleeping with like an ice pack around my head and a cold frozen cloth on my forehead. But, even then, it was only an hour of relief.
What was your reaction to the doctor immediately being like, "Oh, that's Lyme disease"?
Well, I thought maybe they might do some like testing or on it, but I guess it's like you said, it's such a prevalent thing these days.
Were you even considering though, or
Well,
had you noticed it?
Yeah, when it started taking the circular form, and
okay.
my wife looked at it and she's like, that might be a tick bite or something. So, like I said, I'd been out in the yard a few days before, pulling weeds. I grabbed a piece of cardboard to sit down because it was a big job, and I was just sitting there pulling weeds, sitting down on the ground. I must have gotten bit there. Never found the tick. So, but yeah, do not recommend. It was
Never been bit by a tick before,
not that I
found a
know
tick
of.
on
Nope,
you, anything
nope.
like that?
I have a dog, so I found ticks in the house before, but nothing on me or that was biting me. But yeah, it was a rough few days.
Yeah, doctor, when
sure.
we think of weeding, you do think of poison ivy, you think of things like that, but that's not, at least for me, what I would normally associate with ticks. You think of high grass, you think of being out in the woods, not just in your backyard. Is that kind of what we're talking about when we think of how prevalent ticks are this year?
Yeah, and also in terms of the yard, there's treatment for ticks. So I think that could be considered. And also there's leaf litter sometimes.
Yeah.
So ticks kind of like stay in there. But they're usually at the tip of the grass, So you can certainly be exposed and not even realize. And
they're so small, like, the size of them is like very minuscule. So unless you're actively looking for them on your body, you might not even notice that they're there.
Yeah, that's a good point. The deer tick, aka black-legged tick, which is the one we hear the most around here in New England, can be as small as a poppy seed, which of course makes it extremely difficult to notice. So we're going to take a quick break, and we're going to come back and talk a little bit more about the kinds of ticks we're seeing, what you should be looking out for, and again, dive into these symptoms and how serious Lyme disease can get. We'll be right back after this. Welcome back to 12 Health. In this episode, we are discussing tick season and the infectious diseases that can come with being bitten by a tick, most notably, of course, Lyme disease. I'm joined by Dr. Subtain Zia from Southcoast Health and Ryan Clifton, our own assistant news director, who is recovering after recently getting Lyme disease. Thank you again, both of you, for being with us. So before we took our break, we were talking about the size of these ticks. The deer tick, which is the most common one found here in New England, can be as small as a poppy seed. So obviously, it's very hard to detect, very hard to see if it's crawling on you, and probably even hard to find once it bites someone.
Absolutely, and I'm glad you're doing better. In your case, they obviously saw a rash, so that's very helpful. And deer ticks themselves can transmit up to 5 different types of infection. So obviously there's Lyme, but then there's anaplasma, there's babesia, there's Powassan virus. It's rare, but it can have devastating neurological effects, and also Borrelia miyamotoi. So one tick can give you multiple infections even at the same time.
How often do we see those other infectious diseases?
So Ryan touched on this. So like your physician said, if you weren't getting any better, you were still having fevers, they would have probably checked a tick panel, which checks for other co-infections.
Okay. There's also another tick that we're seeing more this year, and that is the Lone Star tick, which is, I believe, a little bit bigger, and it also has a white dot or star on the back of it. And I've read that can actually cause some people to develop an allergy to red meat, which I did see some posts in some of my Facebook groups down in the south part of the state from people who are seeing these ticks. Are those more prevalent this year?
So I haven't seen a case of it, but I think when we think of the Lone Star tick, that would be more in the Capes and the islands perhaps, and maybe more towards the Connecticut side.
Which plenty of people around here do go to the Cape, so...
Yeah. So sometimes it's very hard to tell, which tick it is, but I think the key is to see your physician and get tested and, get the treatment.
Yeah, mine did mention that, the red meat thing.
And you were like, no!
Luckily, it didn't have, that's not the case for me. I would be very sad if I couldn't eat bacon again. But you did mention that. I thought it was, it's sort of stark to hear that when you're in the doctor's office for, you think just whatever, a tick bite, and then, you can't eat all this delicious food anymore.
Yeah. What is it about these ticks that they carry these diseases and that they can infect you so easily like that?
Yeah, so I think it's number one, the weather. More people are out. They don't, if you don't check yourself and you may get bit, you may not even realize it. And it's just over time, there's multiple different kinds of infections. Like I said, there's bacterial and there's parasitic infections too. So it takes a certain amount of time to transmit these infections. But I think it comes down to where you live, what are your exposures like, and how often are you checking yourself for ticks?
Because there is a certain time period from when you're bitten to when you start seeing symptoms, correct?
Correct. So usually, if you check yourself daily, you'll catch a tick most likely, and you may not even need any antibiotics. By day 3, you may need some prophylaxis. And this is particularly talking about Lyme. But anything longer, you may need a full course of antibiotics.
Okay. And what should we be looking for? So when we're doing these tick checks, I think a lot of people are like, all right, well, I'll look for it. But if it's the size of a poppy seed, how am I going to find it? What's the best, most thorough way to check for ticks?
So I would say check your hair, check under your arms, check behind your legs, check in areas that you usually wouldn't check. And also check your pets because they can also get tick infections. So most definitely, see what kind of exposure you're having and,
What about removing a tick? Because that's always been, I think, very, when you read about it, it doesn't seem like it's an easy thing to do if that tick has already bitten you.
Right. So I would suggest CDC actually has a very nice infographic, and it basically shows how to take a tick out. And it's basically shows you, take the tweezers and just, gently pull it out. So that could be very helpful.
Isn't there a chance of when it gets stuck, things like that? That's what I've read is you have to make sure that the entire tick is pulled out, correct?
Correct. So it depends on the size of the tick. So deer tick, for example, has a 2-year life cycle. And so it depends on how big the tick is. So it can be challenging at times.
Okay. And what have you seen? I mean, locally, have you had a lot of patients this year?
Yeah, so if we look at the data from Massachusetts alone, there is this rise, and in 2023, CDC reported about 89,000 cases. And looking at certain other data, the cases could be as high as 476,000. So I think more people are spending time outside, and the warmer weather kind of goes into January now. So there's more time to be infected.
Yeah. Is it really important too? Because Ryan, it took how many days before you went to the doctor?
It's a same day appointment. Called up, got in. I felt bad for the poor doctor. I was literally sweating in the office just from a fever.
Yeah.
But it was probably a little over a week before I got into the doctor. Probably 3 or 4 days after I noticed the rash becoming more circular in shape.
Yeah. I know with infectious diseases, doctor, there's a lot of, you really need to get to a doctor quickly.
Yeah, and this is a classic story. It takes a few days, and sometimes you may not even have a rash, or the rash may look oval, or the rash may look like anything else. So I think the key is getting in, and the story matters. Time of exposure, where were you, and then the testing and the treatment.
Mm.
So really kind of making sure that there's awareness out there, because I think you probably even thought, Ryan, this feels like the flu. This feels like
it felt like
could
a
it
very
be
bad
some
flu?
strain
Yeah.
of COVID we don't know about yet?
That thought crossed my mind too. I have had COVID in the past as well. A little bit of a different feeling. This felt more like the flu.
Yeah.
Just with the chills and the fever, especially, and the headache.
Well,
Yeah.
and we see so frequently that people, in all of these 12 health interviews, I swear that the biggest thing doctors say is people are just hesitant to call their doctor. They're hesitant to go to the doctor. They don't have time. What can happen if you don't get into the doctor quick enough, especially when it comes to Lyme disease?
Yeah, so Lyme can progress to, involving your heart, your joints, your brain. So
Long-lasting effects?
It can be, depending on when it's being diagnosed. But usually, patients feel these symptoms and they come in. So I would say the key is prevention. Key is getting checked earlier and going to see your doctor.
Right, and considering I heard that Lyme disease and ticks are prevalent this year.
Right.
Maybe this could be that. And knowing, like you said, when you were out, when you could have been exposed, things like that, because that's all information your doctor's really going to need, right?
Correct.
Okay. I want to also talk about mosquitoes and infectious diseases, because I know those are stuff that we cover in the newscast as well. So we're going to be right back after this and talk about mosquitoes too. Welcome back to 12 Health. We are discussing tick season and the infectious diseases that come with it. But Dr. Subtain Zia joining us from Southcoast Health. I also wanted to get into mosquito season, because even though we usually go through the whole summer before this really starts to ramp up, we've already started to get the alerts into our system here at Channel 12 of West Nile and Tripoli coming through. And a lot of times we see those infecting animals first, or, mosquitoes test positive, but we don't have human cases. But then as the end of the summer and early fall roll around, we do see human cases of those. And I feel like they've ramped up recently.
Yeah, so I would say as the weather is more warmer, you have more mosquitoes around, and these are rare, but still they can have devastating effects long term. So I would say use repellents. EPA actually has a very nice list of different kinds of repellents that you can use. So prevention is key.
What are the symptoms of those kinds of, if we're trying to make sure our viewers out there know when to really seek medical care, what symptoms should they be looking out for in those cases?
So usually you could have confusion, headaches, if you have any kind of motor weakness, loss of muscle strength, you should seek evaluation. But again, they are rare, but they do need diagnosis and further workup.
Kind of another case of just remembering that we're in mosquito and tick season. So if you get sick or you have symptoms that you're not really clear about, kind of having that in the back of your mind, that it could be one of these really rare diseases.
Absolutely, and we won't know until we see you, we assess you, and go to your nearest urgent care, go to your nearest emergency room, your physician, and get the diagnosis and the treatment.
Yeah, and the ER at Southcoast Health is a good option for something like that, because I know when Ryan was talking about not all doctors' offices, as we know, doctors are in short supply around here. Not all doctors' offices can take you right away. Is the ER a good place to go if you feel like you have these symptoms?
Oh, absolutely, because sometimes you do need emergent workup, and they're very well versed with these kind of illnesses.
Well, and it's nice, too, to know, Ryan, in your case, that you came in, they immediately saw that mark on you and knew what it was.
Yeah, he just, like I said, he took one look at it, and probably from the distance you are to me now, he looked at it and said, automatic positive case of Lyme disease. Could be something else, but the treatment is similar, like he said. So, I was happy to get into a doctor and get that taken care of.
Right.
Because it had been a few days already.
Right. And miserable. I mean, what's your message to people out there? Because, again, I just don't think we maybe because we're so close to it in the news and we see it so often, I think you kind of get this whole it's not going to happen to me.
Right. Yeah. A little desensitized to it with all the stories that we do, almost weekly for sure. I would say, if you notice anything, get it looked at. I waited a few days because I didn't think it was what it was. But, any sort of marking on your body that's new or looks concerning, go just get it looked at. Make an appointment. And then immediately, if you're outside, when you come inside, check yourself. Just look for any creepy crawlies, crawling all over you. If you're out in the yard doing yard work, if you live near the woods, doctor, you said, check your pets as well, because although you might give your pet medication for that stuff, that doesn't stop a tick from hitching a ride.
Yeah.
They might just hop on the fur and come into the house and get you that way. So check yourself, call the doctor if you notice anything strange. That's my message.
Yeah. You wouldn't wish what you went through.
No, I would not. Do not recommend.
Yeah. And doctor, I know we didn't really get into it. We do say this quite often, but kind of go through all of the things you can do too when you're going to be in an environment where there might be ticks and mosquitoes out, aside from spraying.
Absolutely. So prevention is key, and wearing light colored clothes so that it's easy to see the ticks, tucking your pants into the socks. In addition, using sprays that you should, staying on the trail, not going to the woods. So it takes everything to prevent any tick infections.
Do you think it's worth, I know a lot of people get a little concerned, and this might be more of an opinion thing, so feel free to say, I don't feel a certain way about it, but a lot of people don't do the chemical spraying in their yard because they're worried for their pets, or they're worried. But I feel like it's like Lyme disease or chemicals. How do you even make that call?
So, like I said, Lyme can have, all these different kind of manifestations of disease. So look up the different kind of sprays and see what you feel comfortable with. And there are well-proven sprays over the past decades that can be used.
And they do
which are
have
safe.
organic ones too. I don't
Correct.
know how well they work, but I guess something's better than nothing in this case.
I actually have used an organic. Basically, it's just garlic extract in liquid form. You just put it in a sprayer, and your house smells like the Olive Garden, for a few days. But apparently, mosquitoes and ticks don't like that smell. And
so you found that has worked in the past?
In the past, yeah, I have.
I was going to say,
I have
but
not used it this year.
You got bit by a tick.
Yep, I have not used it this year. So maybe it was working, and I need to go back to it. So.
All right. Well, it's a scary thing, but I'm glad we have, I'm glad you're doing better, of course,
Thank you.
Ryan.
Thank you very much.
And also that we can really preach prevention and awareness out there. And again, if you're going outside, just remember, ticks and mosquitoes, they're out there to ruin your summer. Don't let them. All right, Dr. Subtain Zia from Southcoast Health, thank you for joining us. And Ryan, thank you for joining us as well.
Thank you, Shannon.
Glad to have you back here. We missed you while you were gone. And thank you for joining this latest edition of 12 Health.